Hi dear students, welcome back to the class. Are you fine? Yes, okay. So, the last video we have discussed about cardiac cycle, pulse and heartbeat. Yes. So, today we are going to discussing the topic blood group. What? Blood group. You know, this blood group that first discovered by Karl Landsteiner. What? Karl Landsteiner in 90s. Okay, how he find the blood group? Because of one person having the antigens, their blood having what antigen? Sorry, how he find the blood group? Because of antigen, the blood having what antigen on the basis of antigen present or not. So this way we can find the what blood group. A person's blood group is determined by the type of antigen present on the red blood cells, surface of the red blood cells. Like by this way we can find what blood group. Okay. Yes. In most of the pupils they have two types of antigen, that is antigen A and antigen B. Okay. Most of the pupils that having two types of antigen, that is A and B. Antigen A and antigen B. One person having only one type of antigen present on the surface of RBC. Okay. One person not having both antigen. Okay. One person having both one antigen, they are present on the surface of red blood cells. Okay. So on this basis we can able to find what blood group. Not bodies born red blood cells antigen. Okay. See the plasma, it contain what? Antigen, and which attack the foreign. Foreign means what? Some antibodies that comes from the outside to inside the body. So this antigen that attack to that are that RBC's antibodies, not in our body's own RBC's antigen. Okay. Yes. So like this way we can find both the blood group. Human blood that classified into four groups. Okay. A, blood group A, blood group B, blood group AB. Okay, blood group AB and O. Okay, and O. Blood group A having the antigen A. Okay, antigen present on the RBCs, that is antigen A. Okay, and antibody C, that is antibody present on the plasma, that is B. Okay, antigen A present on the surface of RBC in the case of blood group A. So here the antibody that is present in what? Antibody B. Okay, and see the blood group, the antigen on the RBC, that is B only. In case of AB blood group, that is A and B antigen present on the surface of RBC. And O group, there is no antigen present on the surface of RBC. The next is that antibodies in plasma. A group contain what? Antibody B in case the plasma, blood plasma. Okay, and B group contain antibody A, just opposite. Okay, antibody A in the plasma, and EB, there is no antibody in the plasma. And then O group that contain what? That contain antibody A and B. This having antibody A and B. Okay. So which blood group can donate to another group? Just see that donation. A group, blood group A can donate A and B because of this antigen present in A also and antibody B also. So we can donate to AB. blood group. Okay, so we can donate to AB blood group. A group can donate what AB, okay, blood. And B group, there is also what A and B. B is the antigen and A is the antibody. So B can also donate it to whom? Yes, AB blood group person. Okay, and next is see AB group. What? AB group. AB group, there is no antibody. There is no antibody in the plasma. So this also only this donate to this AB group can donate to only the AB group. But see, A group can donate AB and the B group can also donate AB group, and AB group can donate only AB group, not to others or other group. Okay, and O group. O group that's present in both antibody A and B, but nil the word antigen. Okay, but this blood group, O blood group, can donate to all these three blood group. O can donate to A group also, O can donate to B group also, A can donate to AB group also. Okay, and the which blood can able to receive from this group, which blood can receive on this group. See, A group that can receive A and O blood, O group blood. A group can receive only A group, otherwise O group blood. Okay, and B group that can receive only B and O group blood. AB group can receive all groups. Okay, AB group that can receive all groups. Okay, AB and O. In case of O group, it can receive only O group. It can receive, O group can receive only O group. Is it clear? Yes. So we can say AB. You know that this AB can receive all the groups. Okay, so this is called as what? Universal receiver. Universal receiver. AB group can also call what? Universal receiver. And O group. O group, it can donate to all group. O group can donate to all group. So this is a universal donor. Universal donor. Think about this now. O group can receive only O group. So O group, in case, okay, O group does receive what? B blood group. What will happen? Yes, it leads to death. It leads to death. So different blood cannot able to receive. Which one can receive? That only receive that blood, that group, otherwise that person. Okay. So once again, A group is having antigen A and antibody B, and this blood group can donate which group? A group to AB group. Okay. It can donate to AB group persons, and B group can donate to this also AB group persons, and AB group persons, they can donate the blood to only the AB group only. Okay, and O group, it can donate to all groups, but it can receive only the O group. Clear? O group blood. So AB is called as universal receiver, and O group is called as universal donor, because of O group can donate to all other three group, all blood groups, other three blood groups. Okay, and AB can receive all other three blood groups. Is it clear? Yes. Depending on the presence or absence of RH factor. Depending on the presence or absence of RH factor. RH factor means, yes, that is antigen, special protein. Okay. So each type of blood group that's determined in the case of, in the presence or absence of RH factor. RH factor means what? It is a special proteins. It is a special protein which means that is antigen. Antigen present on the surface of RBC and antibody present in the blood plasma. On this space we can divide the blood groups, otherwise determine the blood groups. Right? You know, first this RH factor that is determined in the monkey. In monkey. So if this RH is present in the blood, that is RH positive, and it is absent in the blood, that is RH negative. Okay. So antigen present in the blood, which means antigen present on the surface of the RBC, that is positive, and RBC present absent in the surface of, on the surface of RBC, that is RH negative. So that is this A positive blood, B positive blood, A negative, B negative, AB positive, AB negative, O positive, O negative. You know, mostly all the peoples have RH positive, because RH positive means what? Antigen present in the blood. Okay, so mostly all the peoples have what? Positive blood group. Clear? So this RH positive or negative, these also need to match the other blood group. Then only we have to transfuse the blood. Before transfusion of blood, otherwise before donating the blood, we have to check our blood, or it is positive or negative. So positive person cannot able to give the negative peoples, negative blood group peoples the blood. It will clot the blood, clumping or agglutination of RBCs. Okay, will take place. Okay, so next is ABO system. What is this ABO system? See, ABO system that shows that O group and A and B group also can donate the blood to AB group. Okay, see, A group can donate the blood to A group. Okay, O group can donate the blood to B group also, and this O group can donate blood to AB group also, and the same case A group can donate the blood to AB group, and O group can also donate the blood to AB group. So this is what ABO system. What? ABO system. So this O group is a universal donor and AB group is a universal receiver. Is it clear? And this blood group that is determined by the presence or absence of RH. This RH means what? RH is a special protein that's present on the surface of red blood cells. Okay, maybe this present on the blood cell, RBC of the blood cell, so that is positive. Okay, RH positive, otherwise that blood group is positive. Okay, and in case of absence of this special protein, that is negative group, negative blood group. Okay, so we have to, before donating the blood, we have to check our blood, then only we can able to donate the blood to the same group. That means A group can donate to AB group, and B group also donate to AB group, and AB group can donate only the AB group, and B group can donate to, O group can donate to AB group. So this AB group is a universal receiver. Okay, but A group can receive only what? A group and group O. Okay, and B group also can receive what? Only the B group and O group. Okay, and AB group can receive all the blood. All the blood means all group of blood. A group also, a B group also, O group also. Okay, that is also depends upon the RH positive or negative. Okay, clear? Yes, and O group can receive only the O group blood. Clear? I hope all of you understood this topic. Yes, next we are going to discussing the blood pressure. What is this blood pressure? You know that blood pressure, we have already learned this in the 5th class. The pressure exert the blood through a wall of the artery. That is what blood pressure. Blood pressure means what? It is the pressure exert a blood on the artery, on the wall of arteries. That is what blood pressure. And when the blood, when the heart contract, that time the blood exert the more pressure on the wall of artery. This is high blood pressure. Okay, that is high blood pressure. Sphygmomanometer, that instrument helps find the blood pressure. Okay, so this instrument takes the two readings. One is contractile phase, that means the systolic phase, and another one is diastolic phase, that is relaxation phase. That is relaxation phase and contractile phase. Like these two phases taken the blood pressure. We can measure the blood pressure. Okay. So the systolic phase and the diastolic phase of this two reading. First reading is the systolic pressure of the normal man. Okay, normal human being, that is 120 mm of Hg. Okay, and the normal of diastolic pressure, that is 80 mm of Hg. So this is the normal blood pressure. How much? 120 mm of Hg to 80 mm of Hg. This is the normal blood pressure of human being. So you know sometimes the human beings have high blood pressure. So this constant blood pressure, that is cause our body. Constant high blood pressure, that is harmful. You know that sometimes you heard this word, the high blood pressure, that person having high blood pressure and is having low blood pressure. So this high blood pressure, that person for what they are fall in because their heart is working more. Heart is working more. So this leads to the working of heart. Is heart attack. You heard this word, yes, heart attack. This also cause of high blood pressure. High blood pressure. Clear? So this high blood pressure, that leads to loss of vision and brain hemorrhage and failure of kidney. Okay? This brain hemorrhage occur or stroke occur when one of the arteries supplies blood to the brain, it's ruptured. In physically fit people, their blood pressure always normal, and regular exercise can control the high blood pressure and reduce the risk of heart disease. Is it clear? Is it clear? Okay, thank you.